Hey guys, I'm Dr. Forrest with Allen Spine and Sport, and I'm going to talk a little bit about dynamic neuromuscular stabilization, or DNS, today. So basically, it is based on developmental kinesiology, which is how a baby develops and moves in the first year of life. The positions they put themselves into, how they can use the correct muscles around all of the biggest joints in the body safely. So what we do with DNS from an application standpoint is we take those positions and we apply them to the adult, especially an adult with some pain or some dysfunctional movements, or anyone just trying to improve the way they move, prevent repetitive stress injuries and things like that. So we move through a specific progression of movements, or depending on whatever diagnosis we're talking about, we have our big hitter movements or exercises that we apply to the adult. And there's basically nowhere to hide with DNS. And what we mean by that is we put an adult into the position and we make them move through, obviously with a practitioner. We teach them how to go through specific movements or activate different muscles in a specific position, so that they're using their correct muscles and they're not overloading their joints or overloading half of their muscular system, meaning that half the muscles are way too active and tight and tense and creating improper movements in the joints, and then half the muscles aren't way underactive and weak. So that's why DNS is so effective, is we can activate those typically weak and inactive muscles, so the rest of the muscular system evens out and we're not dysfunctional and putting undue stress on our joints when we're going through specific movements. So that's why we love using DNS and making it part of our treatment protocols. Typically, we're involving joint manipulation to help joints move better, the ones that are stiff and tight based on what we feel. We're taking care of the muscle tension with different soft tissue therapies, dry needling, Graston, cupping, fascial manipulation with our hands, myofascial release, things like that. And then we finish things up by giving some really good activation to those weak muscles by applying correct DNS therapy. So that's a little bit of background on DNS and why we use it. So thanks for watching. Pay attention to our website, social media, things like that for some other content. And again, thanks for watching. I'm Dr. Forrest with Allen Spine and Sport.